Have you ever seen a dental implant or understood the process that we go through in order to start and then have a finished product? I think it's pretty interesting, and so I thought I'd spend a few minutes going over it so that if anybody ever had any questions, maybe it would answer some questions. And if you have any additional questions, don't hesitate to write them down below, and I would love to get back to you on those questions. So I'm Dr. Scheurer, and I'm here at Tranquil Dental, and let's talk about some implants. So once a tooth is extracted or a tooth is missing from an area, as long as there's enough bone, enough width and height and density for an implant to be placed, then an implant can be placed in that area once the extraction has healed, or if you've already had an extraction and there's just an area where there's bone in place. You can have that implant placed. Some healing goes by, and then typically what happens is that a healing cap will be placed after that. So the first phase is to make sure that the bone integrates or grabs onto the implant the right way. And the second is to make sure that with a healing cap in place, the tissue can heal and learn how to treat that like a tooth again. So this is a cast that I have of a patient who had a tooth, unfortunately, that fractured off at the gum line. There was no way to save that, so the tooth had to be extracted and an implant was placed. So this is a model that you can see, and then there's a space there. So for this example, the healing cap is already in place. But what's really neat is there's some pink tissue here that the laboratory will put on there. So I'm going to take that pink tissue off of there so that you can get a little bit of a better view. The implant itself is down, for example, in the bone there. And then there's the healing cap that's sticking out of that position. So if I take the healing cap off, you'll be able to see that the implant is really down, because remember the gums are in this position. So the implant is really down in the bone, and that is like a metal post that's down in the bone and you don't see it or know that it's there. Then as this example was, that gum tissue, that pink gum tissue kind of sort of would have covered it all up. But you saw that stick, that kind of green stick sticking out of there, and that's the healing cap that was in position, allowing the tissue to learn how to treat it. So at this stage, the patient would come into our dental office and be ready to have it restored. So what we would do is to put something in called an impression coping. And so when you put that impression coping into position, it just kind of screws right into place. Pretty neat. And it sticks out further than all the other teeth there. And then we would take an x-ray and make sure that it's in its right position, and then take an impression. And that's the information that would go to a laboratory. Or now that we have my fabulous scanner, the other option is to put something in called a scan body, which kind of sort of looks similar to that impression coping. But instead of taking an impression, then we would send it to the laboratory by the scan. So it's all sent electronically. Really neat stuff. So this is an example of a scan that was completed. So this patient is missing this very last tooth, and this is the digital model that was printed out. And so you can see here again is that implant. This is actually an analogous sample of what an implant would be like, but it's basically the same thing. The implant that goes down into the bone that you really can't see. And there's so many different brands and types and styles and everything, but they're generally speaking all the same. So the implant is down in the bone. And then you can see here, we again have that pink tissue. And so that pink tissue I can remove, and you would then see a little bit of that implant sticking up. You don't normally see that because your gum tissue stays in place, but for the model, you can be able to see that. So once that information is sent to the laboratory, then they're going to fabricate 2 parts. One of them is called an abutment. Sometimes it can be a prefabricated abutment or a custom abutment, but that is the one part. And the second part is a crown, and then a crown will go on top of that abutment. Those 2 pieces can be separate pieces, so that an abutment is then screwed into the implant and a crown is cemented on top of that. Or sometimes the laboratory will fabricate something called a screw retained abutment, which means that the crown is already on that abutment, kind of sort of as one piece, and you don't need to cement anything into place. Instead, you're able to screw it in all as one piece. So this is an example of that case. So you can see where the implant, there we go, where we're missing that tooth, and where the implant would be down underneath the gum tissue. And then the crown can go into position. So you can see that that's a crown. It has a hole for the screw access. And then it's kind of sort of got this little stub there. And actually we can kind of sort of see right through, can't we? So that is the little part, the custom abutment that's going to go in to the implant there. And it'll seat right down perfectly like so and be right in the appropriate bite. You can see it from all angles. That's how wonderful a model is. So that's how you can replace a missing tooth, either by sending in an impression or by sending a scan, either by having a custom abutment and a crown cemented into place, or by having an abutment and crown that's already attached as one piece that is screw retained, because then at the top where that hole is, we fill that in with like a filling type material. And that's a way that you can have a missing tooth be replaced by having the implant placed down in the bone and then the abutment and the crown placed on top of that. So hopefully that helped to answer some questions, and I hope that you have a wonderful weekend.